Hi everyone. I present this talk on behalf of my colleagues at Penn's Ultrasound Research Lab. My talk today is about the early and long-term effects of antivascular ultrasound therapy, AVUS, of hepatocellular carcinoma. So we will start with highlighting some background about hepatocellular carcinoma, which is the most common primary liver malignancy, the second leading cancer death cause worldwide, with a median survival of 6 to 20 months. Currently, therapy includes surgical resection and transplantation, but of course, not all patients are eligible for this type of treatments. So there was a large interest in using local regional therapies, which had a high success rate lately. So in our earlier studies, we introduced the use of a novel local therapy called antivascular ultrasound, AVUS, in the treatment of hepatocellular carcinoma. I will start with giving a brief description of the mechanism of action of this novel therapy. This therapy includes the use of low-intensity ultrasound and microbubbles, which are ultrasound contrast agents. These contrast agents are injected intravenously, and when they reach the vascularity of the tumor, we target the tumor with low-intensity ultrasound. So the ultrasound causes the microbubbles to oscillate at their resonant frequencies. This oscillation will lead to the damage of the endothelial lining of the vessels, causing damaging of the vessel. This damage in the vessel will lead eventually to decreased perfusion of the tumor and eventually to tumor necrosis. In our earlier studies, we achieved a very high success rate in decreasing the tumor perfusion, achieving about 40 to 50%. So in our current studies, we're looking forward by assessing the long-term effects of AVUS therapy and decreasing the tumor vascularity, and also evaluating the tumor response to multiple therapy. So our therapy protocol includes first selecting a tumor for therapy, and we have certain tumor selection criteria, including the size, in which the tumor has to be between 6 to 15 millimeter in diameter, the location, in which the tumor has to be anteriorly located in the liver, of course, and it has to be minimally cystic in structure and well vascularized. So we start with doing a baseline imaging before therapy with contrast enhanced ultrasound imaging. We use two different modalities, which are nonlinear contrast imaging and power Doppler. Then we do the therapy with AVUS, and then we do a post-therapy imaging assessment with the same two modalities. After giving the therapy, we sacrifice the animal for histology assessment. Looking at our results, we will start by looking at the early and delayed changes following AVUS therapy. So here on the left side panel, both the bar graph and the power Doppler images, we can see that following therapy, the tumor vascularity went down. However, when we came back 2 days later to evaluate the tumor vascularity, it went back to baseline level or even exceeded. Here in this example, we see that the baseline tumor vascularity went down after therapy immediately, but 2 days later it went back to normal level. On the other side, when we followed the tumors up to 7 days later after therapy, we didn't see the same trend. It actually continued to decrease, as we can see in this bar graph for multiple cases, or in this image here for an example using power Doppler imaging, showing that after therapy the tumor vascularity baseline went down, and it continued to go down. Now we will look at our findings from comparing single versus multiple AVUS therapies. We will start by looking at an example of a case that received both a single therapy and then was followed by multiple therapy. So here we can see on the left side the baseline of the tumor vascularity. This image is a maximum intensity projection of nonlinear contrast imaging, showing the tumor vascularity at baseline. After therapy, immediately it went down, but after receiving multiple therapies, it vanished. The tumor vascularity disappeared almost, and the change is really very significant and dramatic between multiple therapies and single therapies. In this slide, we're looking at two examples of two cases that received the two different therapy protocols. One received multiple therapies and the second one received only a single therapy. And again, the difference is very clear in response. So the case that received multiple therapy decreased dramatically compared to the one that received only single therapy. This difference is also very clear when we look at the dilution curve here on the right side. As we can see, it went down dramatically in the case that received multiple therapy compared to very low percentage change after receiving single therapy. Looking at the percentage changes in tumor vascularity after therapy, we can see the difference also very clear between the cases that received multiple therapy and single therapy. On the left side, we can see a quantitative parameter of nonlinear contrast imaging, which is called peak enhancement, representing the maximum level of enhancement. The difference between the two therapy protocols was very dramatic. The percentage change of decrease in tumor enhancement was up to 67% in the cases that received multiple therapy, compared to only 37% in the cases that received single therapy. A similar trend was seen in using another quantitative parameter from nonlinear contrast imaging, which is called perfusion index. We also saw up to 62%, 63% decrease in tumor perfusion after receiving multiple therapies, compared to only 34.4% change in the cases that received single therapy on average. So to conclude, here we present some explanations to our findings that we presented earlier. As we went through these findings rather quickly, we wanted here to give a deeper look into these findings and give some explanations for them. So we will start by looking at our findings related to early and late changes following therapy. We believe that there are permanent and temporary changes happening in the tumor perfusion after AVUS therapy. Temporary changes can include vasodilation and also increase in permeability after ultrasound therapy. This increase in permeability lead to an increase in the interstitial fluid pressure, which eventually lead to temporary occlusion of the tumor vasculature. Both these effects will lead to a decrease in tumor vascularity, and we believe that these effects might explain some of the findings that happen immediately after therapy, when we see a decrease in the tumor perfusion and then we see an increase 2 days later after therapy. On the other side, the permanent damages that happen in the tumor vasculature, of course, explain the findings we see 7 days later after therapy. Of course, future validation studies are needed, looking deeper into histology findings and looking at immune responses, of course, will give us more deeper understanding for what's happening. Also, our findings related to comparing multiple versus single therapy. So the use of multiple repeated AVUS therapies showed a higher and more uniform tumor response to treatment. As we saw, it gave us up to 67% decrease in tumor vascularity after receiving multiple therapies, compared only to up to 40% decrease in tumor perfusion after receiving a single therapy. At the end of this presentation, I would like to thank my colleagues at Ben's Ultrasound Research Lab, especially the lab director, Dr. Sandy Sehgal, and my colleague, Mrigandra Karmacharya, and I would like to thank AIUM and the audience. Thank you so much and have a good day.